Hello, everyone, and welcome to the forefront of healthcare innovation. In an era where artificial intelligence reigns supreme, I welcome you to join us on a journey to uncover its impact in healthcare. This is the Future of AI in Health podcast series that we're doing in collaboration with Healthline Media and Outcomes Rocket. I'm your host, Saul Marquez, and I'll be doing this series together with the outstanding Dr. Jenny Yu, Chief Health Officer at Healthline Media. We're excited to give you this series to help you illuminate the path forward on what AI means to healthcare today and in the future.
Well, hi, everyone. Welcome back to another episode of the Outcome Rocket and Healthline Media series on the future of AI in healthcare. I'm your co-host, Dr. Jenny Yu, the Chief Health Officer for Healthline Media, here with Saul Marquez. Saul, so great to see you again.
Hey, so great to see you again, Jenny, and excited for our guest today.
Aniq, I'm so happy to have you here today. I wanted to introduce you to our listeners. Aniq Rahman is our founder and CEO of Fabric with us today. With an engineering background, he's a serial entrepreneur and came into the healthcare space in 2018. I've been watching the growth of Fabric with the acquisition of Giant and Hypnosis, with lots of great things happening. So we're so glad you're able to join us today.
Thanks, Jenny. It's a real pleasure to be here. Thank you, Saul, as well.
So telemedicine has gone through various iterations since the COVID pandemic. And as a founder of Fabric, what are you seeing as the trend?
Yeah, I mean, it's kind of like, I think prior to like March 2020, I think I'd maybe done like 10 Zoom meetings in my whole, in the preceding year. And then it was all of a sudden I was doing 10 a day. And so I think pre-COVID telemedicine, if you look at, total claim lines, it was basically like 0.02%. And during COVID, it was like, 20% of all claim lines. Today, it's maybe like 5% of claim lines. So there's definitely been a dip from the pandemic peak, but it's still part of, our daily lives, right? And I think the evolution is a necessary one because of clinical staffing shortages and capacity constraints, just margin erosion, forcing organizations to really need telemedicine in order to create efficiency and create that hybrid experience. And also, it's what consumers want. Ultimately, healthcare needs to become omni-channel. It shouldn't just be, in person. It should be phone, chat, voice, async, video. And so we're really trying to facilitate that as a company, just broadly.
Yeah, that's great. And I think, the point about omni-channel is so important. I think when you think about the consumer and the patient, they're certainly getting conveniences in other parts of their lives. And so they're expecting that in healthcare. And so we definitely need to move towards that.
Yeah. Oh, go ahead, Aniq. You were about to comment on that.
Yeah, I mean, I think like when you look at a retailer, right? If you're just purely kind of brick and mortar, it's a very difficult time for you today. But if you've sort of made that switch to being truly omni-channel and kind of having, even like a more digital point of sale experience, like if you're the retailers that have 50 people working in the store versus the retailer that has 5 people working in the store, there is like that labor cost curve. And I think in healthcare, you see it just even more acutely because there's just millions of people that work in healthcare in the United States. I think there's 1% of the United States works in nursing, roughly, right? Just if you kind of think about it. And then if you look at the cost curve of acute care, most of these large health systems, they have tens of thousands of people that work in their facilities. And many of them are not physicians. It's, nurses, administrators, clerical workers, environmental services, people that are, doing a lot of very, very important but disparate tasks. And so when you kind of think about, about just the broader shortage here, we have 3.2 million healthcare workers that we're expecting shortages of, and then over the course of the next couple of years. And we're also at the same time seeing a decline in healthcare productivity. And so I think that omni-channel experience also needs to be conscious of labor, just more broadly as well, and how we can better optimize our labor across multiple channels.
Yeah, Aniq, good call outs, and the cost point is a clear one. I mean, we just recently saw Walmart decided to pull out of healthcare. It's because it wasn't profitable. It's hard. Digital first care, empowered by AI. Tell us a bit more about that. And what are you seeing as the adoption within health systems?
Yeah, I think Walmart is actually a really interesting example. And I can't opine on it too much because I don't work there. But just from the outside looking in, it almost feels like they built their healthcare operation like a health system would, rather than the way that a digital upstart would, right? I remember kind of trying to even just do a telemedicine visit because I was curious about the service, and it didn't work in New York, for example, because I think they just, yeah. So I, I wasn't actually that surprised to sort of see that happen, but I think that there's kind of like a wide range of modalities that you can express telemedicine in. I think the simple like video pipe of having two cameras and screens is actually nothing really novel. People have been doing that for decades at this point. People have been doing telemedicine over the phone for a long time. I think where we can get efficiency is through things like asynchronous telemedicine, for example, where we can actually take some of the protocolized workflows and actually create this physician force multiplier, where instead of seeing one patient in a 10 or 15 minute appointment block, you can see 10 patients, and really using AI as a tool to dramatically increase productivity. And I think that's kind of where we spend a lot of time thinking about it as a company, right? Like, how do we, I think it's really difficult to automate a nurse or automate a physician. Like that's definitely not, I think, in the near time window of things that will likely happen. But I think there are ways that you can reduce the total administrative workload or the total workload of the nurse and physician by potentially 2 times or 5 times or 10 times, depending on the task. And that in aggregate ends up becoming a really, really big number and creates a big gain for healthcare.
Yeah, Aniq, really appreciate that. And AI, there's a lot of different types of AI. So I'm just curious, like, what AI are you guys leveraging to help?
You're absolutely right. I think AI kind of has also been around for decades as well, right? There's, I think it's becoming, having a moment in time now with large language models and just sort of the Gen AI movement. But I think, in healthcare, even, a lot of healthcare decision trees have been made for a long time. And I think there's this expert system sort of AI that has existed for a while as well. And we kind of think about that as sort of one leg of being able to take tens of thousands of hours of physician time, for example, to train a model that can give you a very deterministic but conservative look at actually like reducing documentation time or getting, showing you clinical decisions that may not have been something that a physician considered previously, or really even giving an APP or physician just the decision trees and thinking of tens of thousands of physician hours, right? So being able to sort of elevate what a practitioner can do and really practice at the top of license. So there's a lot of different clinical use cases there. There's also a ton of non-clinical use cases as well. I think when patients approach healthcare, sometimes the questions that frustrate them the most are, how do I pay my bill? Where do I go? Where do I park? How do I get an appointment? And so being able to sort of surface a provider that accepts your insurance, speaks your language, understands, your condition, where you're not ping-ponging across the system, is, I think, also another kind of critical gap that technology can really solve. And we're applying AI in some of those use cases as well, some of the, the non-clinical administrative type use cases. And I think the other benefit of that is we can do that in a bunch of modalities. So we can do that through conversational AI on a chatbot on a website. So the little chat agent that will show up on the bottom right-hand side of your screen. We power that for a lot of health systems across the country. We can also do this in the call center. So do an IVR redirect. So when the patient calls into the call center, we can escalate them to the most appropriate site of care, or to the right human, or help them with something really basic like scheduling or rescheduling an appointment or getting a quick med refill, things of that sort that, again, sometimes are the most frustrating parts of healthcare.
Love it. Thanks, Aniq. Appreciate that.
Aniq, you had touched on this a bit already, but I want to talk about sort of the non-clinical opportunities. I think there's so much focus from a health system standpoint on the quintuple aim, which is to reduce costs, improve outcomes, improve the patient experience, and health equity. And there's so many opportunities I see with a digital first care approach in terms of the barriers, right? In terms what you talked about, transportation, parking. So talk to us a little bit about what are you seeing or what are you are already seeing in terms of how Fabric is impacting in that way with healthcare system from that perspective.
Yeah, absolutely. So, I think on the quintuple aim side, it's, if I get this right, it's like improving patient experience, improving outcomes, lowering costs, and reducing provider burnout and increasing equity, right? And so I think like ultimately, it boils back down to, can you thread the needle on improving operations, improving the patient experience, and improving the provider experience kind of in the same go? And I think just technology just broadly, the promise of it has always been that you can actually help reduce the unit cost of care delivery. If you look at Uber, for example, Uber didn't build software for dispatchers. They built algorithms to help obviate the need for a dispatcher so that you could just get immediately routed to the nearest car that met your sort of your needs and criteria, right? I think healthcare hasn't gotten there yet. I think there's been tens of billions of dollars of technology invested in healthcare, but it almost feels like we built software for dispatchers, and we actually turned more people into dispatchers. And so if you look at like the cost of, you look at the number of people that work in healthcare and the number of beds that we have as a country, like the bed curve keeps going down and the number of people that work in healthcare keeps going up. I think that, ultimately increases costs, creates a more disjoint patient experience, and also creates a worse provider experience. And so I think we've kind of missed the mark from a technology perspective. And I think what we're trying to do to rectify that is create patient experience products that also allow patients to just get through the workflow faster, and in the process, provide information that can help a clinician get through their work queue faster as well. So that needs to be increased help them with documentation, help them with getting to the right outcome, helping improve quality and safety, which helps sort of drive that outcome bucket on the quintuple aim. And then I think on the health equity side, I think technology can be one of those great equalizers in terms of getting people access, right? A lot of patients just don't know where to go, who to go to. They don't speak English. And so being able to sort of, use technology to, all of our protocols, for example, in our virtual care platform are translated in Spanish. In our emergency room product, we've translated them into French and Haitian Creole, and, we can add really any language under the sun. And I think with AI, that natural language, sort of the machine translation is just going to get incrementally cheaper to the point where it's just zero. And the AI can help us write more empathetic, thoughtful, conversational protocols as well. And so I think the sky's the limit. I think we're going to actually be going through this golden age in terms of what technology can do in healthcare now versus what it's done over the last 20 or so years in terms of where health systems and healthcare providers have really been investing.
And the comment you made about sort of making the product solution be of convenience and the ideal experience for both the provider and patient is such an important one because I think when you talk about the success of digital solutions in healthcare space, there probably many reasons why something fails, but having that patient and idealizing it for both patients and providers such an important one, I think, in terms of the success of a digital product.
Absolutely. And one other point on that thread is like, one of the reasons why healthcare is so expensive is because patients go to the wrong place. And, I think that triage opportunity, we have kind of symptom checking and triage and navigation to the most appropriate site of care. And so I've spent a lot of time in emergency departments over the years, just sitting with our customers and observing, sitting in the waiting room, shadowing nurses. And, a lot of if you look at the number of emergency medicine visits in the United States, that number actually keeps going up. There's about 140 million patients that go to the ER in the United States every year. Statistically, we're all probably going to go to the ER at some point. And the reasons why people land there are often, it's like 8 p.m. and urgent care is closed, and you're there with your kids, or you're traveling, you don't know where to go, or you have abdominal pain and you're not sure if it's a UTI or appendicitis, right? Like, and really kind of helping navigate patients to the right site. But like oftentimes many of those things could be treated through telemedicine and be done at a fraction of the cost. So rather than paying thousands of dollars, it could be tens of dollars. Even if you go to an urgent care, it'd be $150, but through telemedicine, that could be a $30, $40 visit. And so we think there's just like a win-win-win here really for the system, right? We're helping kind of decompress the ER and help improve throughput for the sick patients to actually get to critical care. You are bending the cost curve to where you're saving hopefully 10x, if not 100x. And then, you're also giving patients a much better experience. Like no one wants to wait 4 hours in the emergency department waiting room for their strep throat. They want to just go in, get a rapid strep test, and go home and get meds and feel better. So that's really what we're hoping, ultimately ends up being facilitated here.
Yeah, Aniq, I love that. And it's that holistic view, right? Just kind of looking at it from a bird's eye view, care navigation, the patient experience. You said patient experience products for the physicians. I mean, I love that. I mean, you sold your company to Oracle, right? Like your previous one. You're a marketer, and you're thinking in terms of personas and what these people need, the people, the patients, the people, the doctors, and the care providers. So I love this. How do you see this approach that you're taking impacting overall care teams' well-being?
Yeah, I mean, I think, I'll give you another example. So our first product that we built is in the emergency department. I think, ERs are one of the places where nursing staff probably burn out the fastest. And some of the emergency departments we've worked with, they have, almost like 100% turnover every like 6 to 12 months. And, a lot of the nurses that are working there are coming in through travel programs. It's just getting rarer and rarer to see the 10-year, 20-year emergency room nurse working in most ERs, unfortunately. And when we're sort of walking through and kind of shadowing what happens, there's certain things that actually happen in the nursing workflow in a fairly consistent basis. So when a patient shows up to the emergency department, for example, they'll get asked, what medications are you on? What allergies do you have? Who's your PCP? Who's your pharmacy? They do a mood and depression screening. And a lot of those questions are things that a patient could just do on their phone. In fact, there's certain questions that patients are much more comfortable answering on their phone, like their sexual health, or like, if you're depressed and suicidal. Sometimes patients just, don't want to say that in a busy emergency department verbally. And so, and in turn, you end up saving 5 to 7 minutes of a nurse's time. You end up over and over again. So something in a busy emergency department that ends up becoming a really big deal. You end up keeping these patients engaged while they're sitting in the waiting room. And so you're helping reduce the left without being seen rates. We also released a feature that we call digital discharge in the emergency department. So anyone that's been in the ER, often you've been seen by the physician, you're cleared to go, you can go home, but you're just waiting for discharge paperwork to come by. And so, this is like one of those things where you've got a patient coding in one room and you've got another, more patients arriving, and you're sitting in this room waiting to go home, and the nurse needs to go to a printer, get your discharge paperwork, find a clean pen for you, have you sign it, and then that goes into a wire basket. Someone from medical records comes by later that day and grabs the stack of papers. They scan those and attach those to the medical record. And that whole thing could just be obviated with a patient just digitally signing on their phone. And so we've done that. And it's one of those things that, saves the nurse's time, gives the patients a better experience, frees up the bed for another patient to come, 30, 45 minutes faster. And ultimately, like, helps reduce the total length of stay pretty dramatically. We're seeing, a faster room to discharge time by about 20 minutes on average, just largely because of that feature. And so these are the things that I think make healthcare inefficient, like just paper, pagers, fax machines. Like we're talking about the AI revolution here, and then we still have these like vestigial kind of remnants of, I have not seen a pager anywhere except in the hospital, in the last like 30 years, right? So, so I think that if we can get rid of paper and pagers and fax machines, like that will be a huge sort of satisfier for people that work in healthcare. If we can kind of take some of this mundane, repetitive work off their plate while also improving the patient experience and improving patient safety outcomes, I think that'll also be a big satisfier.
Aniq, as you were saying all those things, I was having a flashback into my training days, where, still having a little bit of PTSD around the pager and all of those really real life use cases that were, part of the ER experience. And you're so right in terms of, just the need for healthcare systems to move towards this, kind of more tech-driven world in such a way that we can think of all those mundane tasks and how we can all bring that together and really make that entire experience much better for all. I think I want to close out with sort of the question of, when the listeners are listening to us, and if they're not sort of, whether it's experienced healthcare or if they are not as kind of tech savvy or have the digital literacy, what are some of the things that you think, our listeners should be thinking about in terms of being open-minded about and embracing from a AI opportunity? And this could come from sort of your view for physicians, people in healthcare versus, just even people who are listening who are patients or caregivers of patients themselves.
Yeah, absolutely. I think AI is just going to be native to everything at some point, right? Like we're already seeing, like you can't even open up WhatsApp or Facebook now without, sort of seeing meta AI there, or, AI has been running in the background on Gmail and Superhuman and all these email clients for a while now. And so I think that it is just sort of being weaved into everything from, the ambient dictation for providers. It's just kind of happening in the background of healthcare and clinical settings. And I think what patients should be thinking about is like, what are all the, when you walk into the doctor's office or the hospital, like, what are all the things that are happening on sticky notes, on phone calls, on paper, or the things that are just happening over and over again? And how many of those things need to actually happen that way? Like, where are we, kind of to use the Uber example, like, where are we kind of putting these like artificial dispatch points that could ultimately be, obviated by software? And like, to us, the way that we kind of think about it is if we were to sort of take some of those choke points out, and if we're able to sort of, bring the patient and the provider closer together, and just kind of reduce some of those friction points, I think we can actually really drive down the unit cost of care delivery. And I think that's like that. I think is one of and we can create better outcomes, and really sort of meet the objectives of the quintuple aim that you put out there. And so I think for patients, we should embrace AI because it's going to make us healthier. It's going to make our providers healthier. It's going to make the system just work better. And we're, ultimately, like we have this $4 trillion, healthcare system that's going to be 5 or 6 trillion pretty soon. I think there's actually an opportunity for us to sort of reverse course and maybe bring that down by $1 trillion or 2 trillion over time, if we do this right. And again, it's a huge coordination opportunity. It's a huge lift for the system, but I think it's probably the biggest imperative that our generation has as we look at GDP kind of creeping closer to like 30% in healthcare.
Yeah, and Aniq, on that point, a lot of people react to the idea of taking cost out, but when you think about much of that cost is actually waste, you're not actually taking away somebody's revenue or paycheck. Like you could literally take that trillion out and reduce waste while nobody gets negatively impacted. In fact, everybody benefits from that. I love that idea.
Yeah, absolutely. I think it's interesting because I'm seeing now AI companies being built on the provider side that are just like calling the payers and like helping sort of streamline the claims adjudication process. But then it's like a bot talking to a human. But then on the payer side, I think they're also now arming up on the AI side. And so eventually you'll just have like bot to bot communication that's like, or some sort of disarmament.
That's wild.
Because like, these systems, the legacy systems don't have like, they're not all like built with APIs first, right? Like, and I think that's one of the things that, we've historically kind of taken for granted is that if you're building software today, you have the benefit of mobile phones, the internet, cloud computing, and then when you look at like kind of the technology investments that have been made in healthcare, all the EHR vendors basically predated the internet, right? They all started in the 1970s and early 80s. A lot of the technology that powers the payer world also started a long time ago as well. And so now I think AI can sort of maybe we will have this sort of like bot to bot communication that ends up bringing a lot of this stuff to the machine layer, which ultimately again kind of reduces some of that waste that you talked about, which is approaching trillions of dollars as well.
Yeah, no, this has been great. Jenny, I'll let you close it out. This has been awesome.
Yeah, great. Aniq, thanks for being with us today. And to your listeners, thanks for tuning in again for another episode of this. Please check the show notes for some of the key takeaways. And we're really happy to have you with us and see you soon in the next episode.
Thanks so much.
Thanks for listening to our series, Future of AI in Health, our collaboration with Healthline Media. As we conclude this episode, we invite you to stay tuned for more insightful discussions on the series that we're doing together. The future is now, and with knowledge comes empowerment. So I want to thank you for joining us and looking forward to having you with us on the next time as we explore the impact of AI in healthcare today and in the future.